Canterbury DHB bosses have been called out of touch following a tense meeting with mental health nurses today after another assault at Hillmorton Hospital. Yesterday, a nurse was stabbed in the adult acute inpatient unit. Now, that's just days after another nurse was left scarred for life after a patient threw boiling water over her. DHB management met with about 50 mental health nurses today following the attacks, but after the meeting, some of those nurses told Checkpoint that their bosses are simply out of touch. Those nurses told Checkpoint that most of their colleagues in the meeting room had been assaulted at some point. Checkpoint has repeatedly asked for an interview with DHB management about Hillmorton this year. That request was refused again today, but our South Island reporter Logan Church has spoken to nurses who were at the meeting, and he joins us now live outside Hillmorton Hospital. Hi Logan, what was described at that meeting?
Kia ora, good evening. Well, sources I've spoken to say that the meeting you were talking about was originally called for by senior nursing staff who were worried that management were not hearing the nurses' concerns. So at about 10 o'clock this morning, Chief Executive David Mates, Mental Health General Manager Tony Gushlag, as well as the Director of Nursing, who I understand to be Mary Coulson, met with about 50 mental health nurses at Hillmorton Hospital behind me. Nurses who were there told me the mood was tense and even angry. I'm told that the Chief Executive talked extensively about some of the long-term projects that are underway to try and improve things at the adult acute inpatient unit behind me. Some of these were discussed extensively on checkpoints before, including a new 8-bed community care facility that's in the pipeline, as well as various infrastructure and projects underway. But what these nurses really wanted to hear was immediate steps that were being taken by management to stop them and their colleagues being assaulted. And I've been told that they were left disappointed.
So were any immediate fixes at all discussed in that meeting?
Well, I've been told by nurses who were there that they raised the idea again of having security guards there placed in the wards. I mean, we've talked on Checkpoint about how the high care areas, there are 4 of them at the adult acute inpatient unit, are areas of specific worry for these nurses, and a lot of the terrible assaults, including the recent stabbing over the weekend, I'm told, happened in a high care area, but no commitment was made at the meeting. The CDHB in the past have said that they're sort of not entirely sure about the benefits of having security guards on site, but the message from nurses I've been told at the meeting is that they want security guards there, but no commitment from the CDHB on that today, and no immediate changes on the cards as far as we can tell.
What about WorkSafe New Zealand? Have they waded into this? What's their role here?
Yes, well, they told me today that they met with staff at the DHB in April, but then they also asked to meet with the board, that is the bosses of the bosses, in April as well, to discuss the ongoing assault issue at Hillmorton Hospital. But at the time, the board refused to meet with them. So months later, and of course many assaults later, WorkSafe says better incident reporting is needed and risk management needs to be much better. They told the CDHB this week that the current status quo is not acceptable, and are now meeting with the board on Thursday, who have agreed to meet with them.
So Canterbury District Health Board, obviously they've declined you an interview, but have you had an opportunity to chat to them today?
Well, I've been trying to speak with senior management at the DHB about this for about 6 months on the broader issue of assault at the adult acute inpatient unit at Hillmorton Hospital. All we get are statements but no interviews. I put in another request last week to speak to David Mates and Tony Gushlag to talk about the burning attack which happened last week, which we discussed on checkpoints. They weren't available on the day. We left that invitation open. I put in another request yesterday after the stabbing over the weekend, and we were told this morning that they'll try and organise something after the meeting today, which finished about 12:30. I went back to them in the afternoon, and they said that both Tony Gushlag and David Mates were in back-to-back meetings for the rest of the day. But the invitation is still open to come on Checkpoint any time and discuss this. But it's frustrating that they won't speak to us, because this isn't just a case of disgruntled employees. This is a case of nurses who go to work and worry about not coming home at the end of the shift. And it is as simple as that. And at this point, it seems like the CDHB just don't want to answer our questions.
Thank you very much for joining us. That is Logan Church there discussing the serious safety issues at Hillmorton Hospital. And he's right, the invitation stands. If anyone from the Canterbury DHB wants to come on to discuss it, we're available.